About 85 million Americans struggle with unstable housing, food insecurity, and lack of transportation, the combination of which can be almost impossible to overcome, trapping these individuals in a cycle of hardship. Social safety net programs can help break these cycles for those who currently depend on these services. However, there are inefficiencies in the system impacting millions of individuals who desperately need the support.
The agency received a referral for a household of a family that experienced some gang violence. With the Unite Us platform, I was able to assist the family with finding local community resources, which included safer housing, employment, safer schools, finding the children resources like local therapies, and she was so very grateful. I still work with her now. Prior to having the Unite Us platform, some of the challenges included not having enough staff to assist the population or the clientele that we serve.
CBOs are frequently underfunded and understaffed, which leaves people to turn to hospitals and emergency rooms as an alternative option, putting avoidable burden on the healthcare system and payers, an issue that has received nationwide attention. Is there a solution? Unite Us is tackling this problem through technology by building a collaborative platform that enables organizations to work together toward a singular goal: the betterment of individuals and communities alike. North Carolina was the first to build a statewide infrastructure using the Unite Us platform, and the outcomes are overwhelming.
We know that 80% of what really drives health is stuff that happens outside of the hospital and outside of the doctor's office. Stuff like food and transportation, having a job, and being safe. And yet, our entire healthcare system and the way we pay for stuff is designed to pay for none of that. And that's what our Healthy Opportunities pilot in North Carolina is all about. It's taking dollars that are classically spent on things that happen in the hospital and getting upstream, paying for healthy food, helping connect people to employment services. So many providers today are burned out because they feel like they see people over and over and over again, and they don't have the tools that they need to make a difference in their lives. A platform that enables people to be able to prescribe housing or to prescribe food and then see it actually get fulfilled is so rewarding and so relieving to our providers. So I see the Unite Us platform as a game changer for how we think about healthcare finance, a game changer for how we think about provider retention and recruitment into the work that we do. And most of all, I see it as a tool for us to change population health and improve the health and well-being of people in our state.
At the end of the day, most people need access to basic needs, be it housing, food, transportation, and regardless of what city or state they live in, that process should be pretty similar. Unfortunately, across the country, it's pretty fragmented. So what we found in North Carolina is building a common infrastructure that government, community, and healthcare can access to better coordinate and connect people to care as fast as possible.
Social safety net programs must meet people where they are. Technology-driven models like Unite Us are breaking down silos and improving the way sectors are brought together, paving the way for sustainability and scalability.
If you're a governor of a state and you have a single mother that's on Medicaid, that's also on SNAP, that's also on WIC services, those come from different government agencies, and it's very difficult for that individual to access those services. It's also difficult for that governor to see how many dollars we are spending on that individual and is it actually helping them or not. And so when you look at other states that have similar needs or people accessing services, the infrastructure is a foundation that any other strategy that addresses these basic needs can drive their initiatives through.
Oftentimes we see that individuals may have a food need as well as transportation and then housing. This technology platform allows for communication amongst those organizations, and it allows them to track the referrals, communicate in real time, and really help close that loop. It also allows for the clients to not have to retell their story or have to arrive at different organizations and start from scratch with assessments and things like that. A lot of the work that we do, because NC Care 360 is across all 100 counties, we look at it from a state level. Communities know what they need. When we have community-led engagement or community-led buy-in or adoption of this type of technology, what we see is really success, because you can then take the data that comes out of that system and then advocate for additional resources to your local legislators. You can see what your community actually really needs, where those resources are. Having that community-led buy-in and adoption is pivotal.
We've seen a reduction in emergency department visits for people in the pilot. We've seen reduced hospitalizations. And even when you look at how much it costs to do this work, a savings of $85 per person per month. And for folks that don't know, when it comes to insurance costs, that's big money.
We are dedicated to social care transformation, ensuring that every individual has access to the comprehensive support they need to thrive. When we started 11 and a half years ago, we wanted to provide infrastructure to those community-based organizations who are at the front lines taking care of people that were walking in their doors. And then we continued to innovate to provide analytics so they had better data to make better decisions. And then we wanted to ensure that community-based organizations had a seat at the economic table so that their services could be expanded and be paid for and not have to be bogged down by just going after government grants or philanthropic grants. They had enough margin to continue to innovate and hire talent to scale their operations. And ultimately, where we see this going across the country is where social care infrastructure is no different than any other public utility.
Unite Us, your partner for social care. Visit uniteus.com to learn more and explore how we empower communities to unlock their potential.